Hello there! I am Sermae Angelina Pascual from Xavier University Ateneo de Cagayan, College of Nursing. And today we will be conducting a virtual session talking about breast awareness and breast self-examination. Without further ado, let's get started. Okay, but first, let's go through our session's objectives. So first is we must discuss and describe what breast self-examination is all about. Next is to give emphasis and importance of breast health awareness and breast self-examination. And lastly is to discuss the different steps in examining breasts. Breast self-examination for breast awareness is an inspection of our breasts that we do on our own. This is to help increase our breast awareness. We use our eyes and our hands to determine if there are any changes to look and feel of our breasts. A breast self-examination that we do for breast awareness is to help you understand the normal look and feel of your own breasts. So if you noticed a small change or even a big change that seems abnormal, or if you noticed one breast is different compared with the other, you can report it to your doctor. There are many conditions that can cause changes in your breasts, including breast cancer. Although the breast self-examination technique isn't always a reliable way to detect breast cancer. However, a significant number of women report that the first sign of their breast cancer was a new lump they discovered on their own. For this reason, doctors recommend being familiar with the normal consistency of your breasts. Here are some examples of women affected by breast cancer. Now, I will be presenting few videos on how to perform breast self-examination.
Breast cancer is the most common cancer affecting women in Singapore. It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breasts, underarm and collarbone areas more accurately, do so by lying down because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
Hi, I'm Dr. Laura Cooper, one of the breast surgeons at City of Hope. Today I'm going to talk to you about self-breast examination. Around 8 out of 10 women detect breast cancers or breast lumps themselves. Therefore, it's important that every woman understand the basics of a self-breast examination. There are actually 2 components, look and feel. For the first part of the exam, looking, you want to stand or sit in front of a mirror. With your clothes off, you want to look at both breasts to see if there are any differences between the 2. Examine the nipples to see if there's any difference between the 2. Is one redder than the other? Is one pulling in? Then you want to put your hands on your hips and turn from side to side to see if there are any changes. While standing, you actually want to put your arms forward on your hips because this will bring out lumps that might not appear otherwise. It's important to raise both arms above the head. This will draw out any puckering or dimpling for masses that might be underneath the nipple. If you're standing like this and you have a mass that's kind of in the lower part, you might not see it at all. But when you raise your arms, what happens is that mass kind of stays and then the skin kind of pulls in as you're pulling up. That was the first part of the examination. For the second part, you want to be lying down. You want to put your head on a pillow to prop yourself up and place one arm behind your head. Then with your other hand, you want to use your first 3 fingers. When you use only 1 finger or 2 fingers, you can actually separate the breast tissue and think that you feel something that isn't there. You can do this one of 2 ways. You can either go in a circular motion all the way around the breast, making sure that you overlap every area, or you can go up, down, all the way across. I prefer the circular motion, from the collarbone to the sternum or mid-chest, below the breast, and then all the way actually out into the underarm. Lymph nodes are underneath the underarm, and sometimes those can become bigger. When you're doing the breast examination, you're looking for things that feel different from the surrounding tissue. What you're looking for is something that stands out, something that feels like a pea or a marble or a walnut. You want to make sure that you do this examination at the same time each month. Remember, the most important thing about a breast self-examination is to know your breast. That way you can note any changes and alert your doctor.
Now, how do we examine our breasts? First is we must lie down with our right arm behind our head. Lying down spreads the breast tissue evenly over the chest wall, making it easier to feel. Next is we will use the 3 middle finger pads of our left hand to feel for any right breast lumps, using overlapping small circular motions to feel breast tissue. And then, We will use light pressure to feel the tissue closest to the skin, medium pressure to feel deeper, and firm pressure to feel the tissue close to the chest and the ribs. We must use each pressure level to feel breast tissue before moving on to the next area. You may feel a firm ridge in the lower curve of each breast, which is normal. You must tell your doctor if you feel anything else out of the ordinary. Move in an up and down pattern, starting at an imaginary line drawn straight down your side from the underarm. Move across the breast to the middle of the chest bone, sternum, or breastbone. Check the entire breast area, going to your ribs and up to your neck or your collarbone. The up and down vertical pattern is most effective for covering the entire breast. Examine your left breast by putting your left arm behind your head and using your right hand finger pads to do the exam. Next, stand in front of a mirror and press your hands firmly down your hips. This contracts chest wall and muscles and emphasizes any breast changes. At the same time, look at your breasts for changes in size, shape, or contour. Note any dimpling, redness, or scaliness of the nipple or breast skin. Examine then both underarms while sitting up or standing, with your arms slightly raised. Do not raise your arms straight up, because it will tighten the breast tissue, making it difficult to examine. Now, we will have a short recap. Okay, so first, there are 3 motions in examining our breasts. First is the circular motion or the clockwise. Next is the wedged motion. And lastly, the vertical stripped motion. Question: what is the most effective motion to follow when examining our breasts? That's right, the vertical strip motion, because this covers the whole area of our breasts. Next question: in examining our breasts, how many fingers should we use? That's correct. We use our 3 finger pads in examining our breasts. And lastly, when examining our underarms, should we raise our arms straight up or just slightly raised? That's correct. We should only raise it slightly up because raising it straight up will tighten the breast tissue, making it difficult to examine. The purpose of breast assessment is to identify signs of breast disease and initiate early treatment. The incidence of breast cancer in women is rising, but early detection and treatment have resulted in increased survival rates. That is why breast self-examination is important. Especially this pandemic, where we are all in our separate homes, we can be able to check our own breasts for possible dangers with the knowledge that we have gained from today's session. Feel free to replay the session whenever you need a guide. Remember, ladies, that early detection and treatment have resulted in an increased survival rates of breast cancer. Keep safe, ladies, and God bless.